If you were to visit Gaza right now, if you were to step into some of these densely populated encampments where the more than 1.9 million people who are currently displaced within Gaza, or more than 85% of the population within Gaza, are looking for refuge and safety, you might notice a physical symptom that you haven't seen before. You might notice that many of those who are surviving have a yellowish tinge to their eyes or their skin. The clinical term for that is icterus or jaundice. Medical providers are reporting an abundance of jaundice, presumably associated to outbreaks of viral hepatitis, one of the many diseases increasing as reported by the Palestinian Ministry of Health. Testing within Gaza is difficult for obvious reasons, but of those patients that they were able to get tested, there have been at least 1,000 documented cases of hepatitis A. Hepatitis A is a highly contagious viral liver infection, and symptoms can include abdominal pain, nausea, vomiting, fever, headache, and even yellowing of the skin, which is due to an accumulation of excess bilirubin that is due to the impairment of the liver from the infection. Those infected with hepatitis A can shed high amounts of viral particles within their feces, which brings me to one of the more concerning symptoms of this virus, which is diarrhea. This infection is probably just one of the reasons why we're seeing increased rates of diarrhea within Gaza. On November 16, 2023, there were an estimated 16,000 cases of diarrhea for children under the age of 5. On December 12, 2023, a WHO representative explained to CNN that there was an estimated 160,000 to 165,000 cases of diarrhea, all in children under the age of 5. And with that, it's important to understand that the UN Children's Agency has previously explained that in zones of conflict, children under the age of 5 are 20 times more likely to die of diseases related to diarrhea than to violence. Hepatitis A outbreaks are not uncommon even here within the United States, but thankfully there are methods to help prevent its spread. Let's just go through some of those common methods. First, access to clean bathrooms and disinfectant to prevent transmission from one user to another. And it's important to know that the majority of the people within Gaza have no access to viable sanitation. In some places, up to 600 people are sharing one toilet. Another method, hand washing. It's recommended that you wash your hands at least 15 seconds to help prevent transmission from one person to another. An estimated 4% of fresh water within Gaza is drinkable, and the surrounding seawater is polluted with sewage. And water from the sky brings more harm than good to the people within Gaza as they continue their wet and rainy season. As the rainwater causes flooding, all the surface fecal matter, as well as the decay from the decomposing bodies from some of the more than 18,500 people who have been killed within Gaza since October 7, can contaminate water reserves and wells. Nutrition is also an important method to maintaining a healthy immune system and again preventing infection and transmission. According to the Deputy Executive Director of the UN Food Program, more than 90% of those who still remain in northern parts of Gaza are not eating every day, and more than 66% of those who remain in southern parts of Gaza are not eating every day. And malnutrition doesn't just stop at losing weight and increasing risk of infection. Malnutrition is associated with brain atrophy or brain cell death, iron deficiency, anemia, and even sudden cardiac death. The risk is increased for children and pregnant women. According to the UN Sexual and Reproductive Health Agency, there are an estimated 45,000 women who are currently pregnant within Gaza, and an estimated 68,000 women who are currently attempting to breastfeed within Gaza. As you can see, for the people within Gaza, there are limited to no options to protect oneself from this disease and to prevent the spread of this disease, which is why we're also seeing increased reports of measles, meningitis, and chickenpox. The Palestinian Ministry of Health also reports an estimated 133,000 cases of upper respiratory infections and approximately 17,000 cases of body lice. And options for medical care are dire, as two main hospitals that are operating within the southern parts of Gaza are operating at 3 times their capacity. The healthcare system within Gaza has collapsed. And for the majority of the people within Gaza, there are no options to leave. Their only option is to huddle together, hope for safety in areas where there is no guaranteed safety, and await the inevitable, the spread of disease. If you'd like to donate to Doctors Without Borders, the link is in my bio.